Hi, my name is Emily and I'm here to talk to you today about the risks associated with diabetes. For a little bit of statistics, in 2012 alone, there are 29 million people in the United States living with the disease. It is the seventh leading cause of death and is greatly associated with stroke, heart attack, and cardiovascular collapse. Out of these people, over 15% have developed diabetic ulcers. The reason for this is greatly associated with diabetic neuropathy, where you have that burning and tingling sensation in your feet. You really can't have a good grasp of what you're actually stepping on. And also what happens is peripheral autonomic damage, which means you're not sweating like you should. And as a result, your feet end up cracked. As a diabetic, you're also more prone to infections. So add those all together, and that's a perfect cocktail for an ulcer. A thing you can do to prevent these, you can do routine foot checks. According to the American Diabetic Association, you should be checking your feet daily when you have the disease. Sometimes you want to wash them with like a white washcloth to make sure you can see if there's any blood or any residue whenever you're to check your feet. Also look in the mirror and see, and if you can't reach the mirror, have a loved one help you. Try to look in there and see if there's anything wrong. You should also be checked for numbness and tingling in your feet and maybe put on something like Neurontin. Also to help prevent that is proper nutrition. You want to keep your blood glucose levels between 70 and 110 fasting. A good way to check this is always check your blood sugars at least before meals and at bedtime, and give yourself the required amount of insulin if you take it, or continue to take your oral hypoglycemic agent. Another thing you can do is follow the CCD diet. You want to limit the amount of refined carbs, increase the amount of complex carbs, whole grains, foods that are high in fiber, high in protein. In addition to this, you want to try to lose some weight if needed. Losing weight will definitely help decrease your blood sugar levels. And in addition to this, besides keeping your blood sugars under control, when you do that, it helps prevent cardiovascular damage, because what happens is the elevated blood glucose levels causes micro and macrovascular damage, and thus decreases the circulation, especially to extremities where you usually get the ulcers. If you do end up getting a wound, first thing you should do is go see your doctor, and you'll probably have a referral to either a podiatrist and get diabetic shoes, or to a wound care center like the one at Western Maryland Health System. Whenever you have a wound, you want to make sure you adhere to the treatment plan. You want to elevate your feet, you want to wear the appropriate shoes, you also want to moisturize your feet to prevent any further damage. In addition to this, you want to keep your blood sugar levels stable. You want to keep them, like I said, between 70 and 110 while fasting. And you want to increase your protein too. Protein will help you be able to heal properly. So as long as you're compliant, your wounds, as long as you're coherent, you listen to the plan of treatment, you should be good. And that's about it. Just remember diabetes is a chronic disease. There's no real cure for it, but there's maintenance. You can live a long, healthy, happy life and have, well, your feet, they might be stinky, but they can still be healthy, as long as you follow those few simple tricks. Thank you.